helping health systems solve what we consider to be a $1 trillion problem, which is the coordination of these patients and keeping them on their care plans, and really helping the hospitals break down their four walls and extend, create this new definition of what a hospital is, which is really an anywhere, anytime care network. And we can be the enablement platform that makes that happen. Cairns Health developed Luna to solve what we consider the thorniest problem in healthcare, which is taking care of these very complex patients and simplifying their care. Luna is a device that sits at the bedside, has radar built into it, and the radar can detect heart rate, breathing rate, patient context in the room. It detects sleep stages, in and out of bed. So we use that context and changes in the data that come out of that to then use a large language model to intervene. And that large language model is really built around developing a relationship and a rapport with the patient. So with this device in the home, we can extend the four walls of the hospital. We can have care plans updated in real time at the bedside. So if we notice something happening with a patient, let's take a congestive heart failure patient as an example. Maybe we notice that for 3 days in a row, their weight has gone up. That patient can receive a new care plan that says increase your level of diuretics. And so it's really about making sure that these chronic conditions, which when we have this rapidly aging population, there are going to be more and more chronic conditions, but we can make sure that they don't become acute. And so when we think about things like ROI, it's about reducing readmissions, keeping patients out of the hospital for unnecessary visits. It's about lowering the overall cost of care because we can continually course correct for these patients. All this talk about AI is great, but it's really about what the technology enables. It's not about the technology itself. Like that for me is always the important message here, is that what good is great technology if it's not impacting someone positively at the point of care and getting the results that we all want from our healthcare system and moving the needle forward, right? We're also increasing the likelihood that a patient will engage with their voice, with their healthcare system. I think one of the beautiful things about what we've developed at Cairns with Luna is that it's voice-driven healthcare. We are taking healthcare and turning it into a conversation, which allows it to become a part of a lifestyle.